The Georgia Department of Audits and Accounts provides independent, unbiased information and impactful recommendations to promote accountability and improve government. We have released a report on the personal care home program within the Department of Community Health. We found that the department has not routinely inspected many facilities or used its authority to impose penalties when violations were identified. The Department of Community Health's Healthcare Facility Regulation Division, or HFRD, licenses and regulates healthcare facilities. HFRD inspects nursing homes and hospitals on behalf of the federal government, as well as personal care home facilities which are regulated by the state. Our audit focused on HFRD's oversight of residential personal care home facilities, which include more than 2,800 facilities that house nearly 48,000 vulnerable residents. HFRD licenses new facilities, monitors for compliance during routine inspections, and investigates allegations when someone submits a complaint. If violations are found, HFRD requires a plan of correction and may impose a fine. This is required for serious violations. Sanctions may include suspension or revocation of a facility's license, but this is rare. Our review found that HFRD has conducted few routine inspections, leading to limited oversight. Of the more than 2,500 facilities active from 2019 to November 2024, HFRD inspected only about 20% within its internal goal of 18 months. The remaining facilities were either not inspected within the last 18 months, including some facilities that had not been inspected in more than 5 years, or not inspected at all since 2019. 600 of these facilities did have site visits due to complaints or other reasons, but these were less comprehensive than routine inspections. Additionally, HFRD has not consistently followed its guidelines regarding complaint investigations and penalty enforcement. Of the 190 complaints reviewed, 30% could have been categorized as higher priority by HFRD, which could have delayed those investigations, potentially placing residents at risk longer than necessary. In addition, while most complaints were investigated within required timeframes, some were delayed. Between 2019 and 2024, we found 50% of IJ complaints had investigations initiated after HFRD's required window of 2 business days, and 13% of non-IJ high complaints were initiated after 45 calendar days or did not have a record of an investigation start date. HFRD also did not impose fines on all serious violations, which HFRD procedures state incur a mandatory fine. Total fine amounts have decreased in recent years. This is due to fewer violations being identified since 2020. Additionally, we estimated that nearly $500,000 in additional fines could have been assessed had HFRD imposed fine amounts on the serious violations identified between 2019 and 2024. Additionally, HFRD has not ensured facilities with violations return to compliance. HFRD has not collected a large percentage of the approximately $322,000 in fines assessed over the past 3 years. At the time of our report's release, approximately $93,000 remain outstanding. This is due to inconsistent correspondence and HFRD's inability to track whether payments have occurred. In addition, HFRD relies on plans of correction to bring facilities into compliance. However, HFRD has only verified completion for less than 20% of the plans submitted. Finally, HFRD lacks written procedures for some core operations. For example, HFRD has no policy regarding how facilities should be selected for a routine inspection or which requirements to sample during the inspection. HFRD instead relies on individual surveyor judgment to make such decisions. Additionally, while HFRD has written procedures on complaint triage and penalty assessment, they are not comprehensive or exclude some processes HFRD mentioned in interviews. We recommend that the General Assembly consider codifying a required frequency for routine inspections. We also recommend that HFRD perform inspections within its established time frame, establish additional guidance for prioritizing complaints, ensure that non-compliant facilities are appropriately fined, and develop more written procedures and establish clear guidance within existing written procedures. You can learn more by reading the full report, available on our website.